really good at messing up hair, so I'm going to try not to do that because I feel like it's like in perfect mode.
It's not. Seriously, all I did was dry it and just take a flat iron over where the messy areas were.
Lay down, this rope can get a little snug. I'm just going to loosen it just a little bit so it's a little more comfortable as we do our massage. I'm going to just say you've been dry, oily lately.
My skin used to be normal, but I don't know what happened. It all kind of, I used to never have acne. If I had one pimple, it was acne for me. But all of a sudden, it just went dry, and I mean, I moisturize as much as I can, several times a day, even. Hyaluronic acid, the AHA moisturizer, it stays dry.
Really? It does feel pretty balanced right now.
Probably because I have the moisturizer on it.
Yeah.
I had just put it on, like, before I left, basically. Which I don't know why I did, since I was going to get a facial, but...
You know, I'm going to walk out the house. You don't know what's going to happen.
I know.
Like walk into a desert tundra.
Just have it, honestly.
Yeah, if I don't, my whole instantly dry out.
I just don't understand because my skin used to be so clear before I started using really good products on it.
That's interesting.
And then once I started using esthetician grade products, I don't know why, but my skin just panicked.
Well, hopefully after today we'll get you like on a good like trajectory where it's feeling better.
Because even at school, like, I mean, I was getting hydroabrasions, chemical peels, and laser resurfacing, and straight oxygen into my skin, and all kinds of stuff, and it never, honestly, it just made it worse. Because the school owner, she just wanted to do everything, because she doesn't like for any of her students to walk around in scrubs without clear skin, which I can understand why, but she was like so determined to get mine under control. But I mean, I was just like, I really think that a lot of the cause is diet, because I mean, I don't have the best willpower, and recently I had to give up two of my favorite things, gluten and dairy.
Right.
Because I haven't been diagnosed with RA forever.
So we'll work on doing a little facial massage and lymphatic drainage and some detox. So we want to detox like the muscles and the tissues and the skin and the face. And that will definitely help. And is that steam still doing okay? Okay, good. good. My pressure, feeling uncomfortable. Is it good so far?
It all feels great.
one more press, and now I'm coming back down because we're going to switch to the other side. And when I transition, I usually give a little massage to our lymphatic drainage points, which feel really good. A lot of people keep tension in the jaw right there. So you can take your 2 fingers and your thumb. So we're massaging, and then slide them under the neck. These can go underneath the cheekbones, and then you're kind of doing a double massage where you're getting like the occipital bone with your fingers, and then you're getting this sinus pressure point with your thumbs. And I'm not pressing too hard because you don't have any slip over here. And then just transition to the other side where we do the same thing. That's the Raj. And then we bring it up. This corner of the mouth can get kind of droopy with gravity. So working this like buccal muscle and pushing it up like this really does make a difference. And same thing with the jaw. You can pinch and massage this area especially. This is lymphatic drainage. And pinching and rolling on the jaw feels really nice and helps firm this up, helps with lymphatic drainage. And now we're going to do our 2 fingers going up to the pressure point underneath the cheek, the sinuses, which is going to really come in handy now that it's about to be winter time. And even right now, everybody is so sinusy. So, I mean, when you can't breathe and you're not feeling great, your whole face feels puffy, and like getting something like this done, it not only does your skin look good, but you're feeling so much better because you don't have all this sinus pressure anymore, and it alleviates a lot of puffiness from your face. So we're still pressing. I'm doing it a little bit different than I did on the other side. She has a little breakout right here, which is really hindering the exact place that we did on the other side, so we're just doing it different. We're going to go to that temple area, working up, and we're using significant pressure because we want to give our temples a little bit of a massage. It's a big muscle that we use. And then we're going up, we're hooking that brow. So when I do this and we go up and we kind of slide down, you absolutely need to make sure that there is plenty of slip, because if you have any friction and you're pulling, it hurts so bad. It feels like an Indian burn or rug burn. So when you press and slide, make sure you are never pulling on the skin. But this feels good. And then we'll go down to the temples, down to the jaw, the whole jaw, back of the neck. Bring our thumbs down to the base of the neck. Do a little massage here. Flip over your hands, and now you're doing like the collarbone slide and the trap slide. And then thumbs going to the shoulders finally. Another lymphatic drainage point. And so we've done all of our facial massage, depuffing, detoxing, and there are some places that we didn't get, so we're gonna go back over like the nose, the upper lip. And we'll just go in with that, always kind of coming here, up, and then just getting the chin and the upper lip. Another thing, make sure like with the forehead that you're never pulling down at the same. You don't want to split somebody's chapped lips open if you start to pull down hard. You always want to alternate and be extra mindful of something like that. And then we do the nose. You know, the same way you do all the noses. You okay? Oh yeah. Yeah, do you feel like it's a pimple or just like a...
Oh, I'm just trying to watch it.
Did you like run into the wall in your sleep?
I don't know.
The big that reminded me. So she's got a sensitive spot on her nose, so we're going to be really careful around that area today. So all that is finished. I'm just giving her a little more love before I grab my sponges. Whenever you release from your client, you're never just taking off your hands. You're always slowly tapering off. They will start to learn exactly what your motions mean. So they know if you're pressing, slowly tapering off, you're gonna release. Same thing when you come back, bring your hands in slowly and taper on. Or sliding off is good too. You can slide off if you want to. But everything like you're a ballerina, it's, you know, dancer like. Take our sponges, wring them out, hold them, thumb, and then the rest fingers. And then they always start on the shoulders, work your way up, back of the neck. We certainly have soap there. And we're just gently removing our product. Be a lot of combinations of patterns that would work well. Really important to get around the nose, and steam can gather. I'm so sorry about your little blue on your nose. I was getting aggressive. So
I'm hurting on purpose.
Okay, so now we're going to do an exfoliation step. You can add or subtract or do whatever exfoliation that you think is right for their skin. She's already a little bit red. But I think that she does need a pretty decent exfoliation. When was the last time you used the turmeric? Ever? Never ever?
It's just sitting on my sink.
Okay, so we're gonna tiptoe into giving the turmeric a try. If I feel like it's too spicy for you, we'll just like take it off. But we're gonna do like the turmeric powder. And so this ingredient, you can mix it with water or a cleanser. I'm gonna mix it with a cleanser. And this is going to be our exfoliating stuff.
Which cleanser is it?
I'm going to use the Microbiome Foaming Cleanser. Charlotte,
Yes.
with your product knowledge of so vast, will you tell us a little bit about the Microbiome Foaming Cleanser?
So the Kombucha Microbiome Cleanser has green tea, white tea, and black tea. So it is an anti-inflammatory powerhouse. It's great for pretty much redness associated with anything, whether it's age, sensitivity, acne, whatever it is, it will help. It's also got lots and lots of prebiotics to feed good bacteria, probiotics, and postbiotics, which are kind of the results of the probiotics being alive. All of which not only help kind of get the skin's microbiome back into balance, but have their own skin helping benefits outside of that. So there's a lot of natural brighteners in there, which is going to be really nice for this kind of inflammatory acne that Emily's got. It's going to help it keep from scarring, which is huge. It's got a lot of like I said, anti-inflammatories in there, so it'll help not only calm the redness, but also help with the physical inflammation and just bring any swelling down. And it's going to help kind of get that P. acnes bacteria in check, so those breakouts can get out of there. And it It smells really, really nice. It's got just a little bit of jasmine flower in it, not a ton, but enough to be therapeutic so that it does relax the client, but it also, jasmine has been used for centuries for treating acne.
Oh my gosh, yes.
Antimicrobial.
Anytime you need to scratch your nose, you just throw your hand up here and scratch your nose. You're not going to get in my way at all. The most important thing is I just want you to be comfortable. Is that steam still feeling okay? Okay, it's looking pretty good. So we're doing a lot of the same motions that we did with our cleanse, with our exfoliant. And is the turmeric feeling okay on your skin? Okay.
Just a little tingle, but it's
okay.
Yeah, that turmeric has a bit of tingle to it, but using it in the second cleanse like this, paired with another cleanser, can help kind of take out some of that bite. So you get all the anti-inflammatory awesomeness of turmeric without the irritation, you know, the heat that the not irritation, but you know, prickly heat that can come with using that exfoliant by itself on particularly sensitive skin.
With your exfoliant, there are a few areas that I do really like to focus on. One is the chin, and especially either sides of the chin. You can get a little bit of like drooping and sagging in this area, so the skin starts to kind of fold in on itself, so it doesn't get exfoliated as well. I mean, obviously for Emily, she's super young, she doesn't have that, but most of our clients are, you know, past 50, and you know, a little bit of like gravity is going to happen. So the chin and either sides of the chin, right here by the nose, there tends to be a lot of large pores. I'm doing it a little bit more gentle on Emily's skin because she already has a little redness, but you can go in a little bit stronger with a lot of our clients that are not like redness prone or rosacea prone, just to really exfoliate and treat any areas that have large pores. And is this pressure okay on this side? Okay. And another place to really focus on with your exfoliant is that eye area. I don't want to keep calling it the crow's feet area. Charlotte, what would you call it?
The outer orbital area.
Okay, outer orbital, where the temple is, the temple area.
Yep.
Really work your exfoliant around the eyes, because that is where a lot of dull, dead skin settles into the fine lines around the eyes, and it makes them a lot more pronounced when you put on makeup or anything, or you smile. And so doing a really good exfoliation here can really buff out a lot of those fine lines. Okay. Making sure we do not forget about the upper lip. Give that area some love. And then most things, most cleanses and most everything, we're going to start at the shoulders when we apply, and then we're going to work all the way up and then work our way all the way back down, so that when we take our hands off of the client, we're usually leaving from the shoulders and coming from the shoulders. That's like the least, you know, like jumpy part. You know, you kind of expect somebody to touch your shoulder, but not like your eyebrow, you know. So she's completely covered and exfoliated. We're gonna use our Clarisonic brushes with our exfoliant. I have exfoliant all over my gloves. At this point, I just lose this pair of gloves to keep my equipment more clean. You have two choices. You can put a new set of gloves back on right now, or you could just, with your clean hands, grab your Clarisonics, dip the brushes in your hot water, wring them out a little so they're not dripping. You can dab them on your towel, and then you can test them on your wrist to see how hot they are. These could be a little hotter, so I'm putting them under the steam, because I want it to feel super warm, almost like a hot stone. And we start on the shoulders and we're going up. Is that okay? Okay, great. And so we're just doing a really good exfoliation with these guys. I love to focus on the neck with these. We really can't get a good scrub on the neck with our hands. And there are a lot of fine lines and wrinkles that happen around the neck. So like definitely the base of the neck all the way up, and you make sure, it's not my grandma. You make sure now, you want to make sure that you get under the chin. Like people's problem areas are under the chin so much of the time, and it just feels good that you're giving that area some extra attention. The Clarisonics feel really good. It's an area that they can't treat a lot. So under the chin, definitely we're going back to the lymphatic drainage points, giving those a little massage. You just want to make sure that you do not get their little baby hairs caught up in this. It will not be comfortable. Doing the top lip, really important. Outer orbital area, forehead. Have you seen that that TikTok where it's you say something like very medical sounding, and so you like insert yourself into the cast of Grey's Anatomy?
Yes. Yes, that outer orbital area.
That's what I sound like.
Yes.
Okay.
Yes.
With the nose, I like to go down the nose and then just use both of them to slide down each side. Is this feeling okay on your like sensitive spot? Okay. Getting under the eye. Cheeks, you can go a little bit lighter. You want to be a little bit more gentle with the cheeks. And just like everything else, we started down at the bottom. We're going to work our way up and then work our way back down. And we're not just bringing them back down. We're doing another hit of everything on the way back down. We're exfoliating again. Definitely like the décolleté area is an area that would be really good to treat with this. I love to do the shoulders. Well, like, you know, they want their arms to look nice. Do the shoulders. And then we're pulling them down and slowly tapering away. Turn them off. These guys, you're going to pop into your water. And then I usually go ahead and re-glove. So anytime you have any exfoliant, it's going to be a little bit harder to get off than your cleanser. Like my sponges are not as hot as I want them to be, so I'm putting them in the steam. Starting at the shoulders, working our way all the way up to the back of the neck, the ears. Your sponges will fill up with exfoliant, and you really won't be able to get any more off until you clean your sponges once more and then go back in to get the rest of the exfoliant off. Paying like really close attention to the hairline and the eyebrows. It's where the exfoliant likes to hide. Cleaning my sponges once more. I didn't start at the shoulders that time. Really want to go across the nose pretty well, because these steam droplets will start to collect as your client is breathing, they'll collect around the nose, and it can be pretty tickly for their nose. So we're pressing, and then we're slowly tapering off with our sponges. I usually like to slide down their hair wrap and go completely off the bed. It seems so arbitrary to do that, but I swear you can feel the difference. Emily, does that feel different at all? Like if I am taking off of your head or just going down like this?
I feel it until about the middle of my head.
Okay, so I do that. And now we're gonna go in with a hot towel. Test it, of course. On the décolleté, and we're pressing in, and there's two ways to do this. One way, if you just go in and you press down, you can tighten the towel over their throat. Does that feel, could you feel that? Because I mean, it's subtle, but you don't want to cause any like fear of strangulation. So you take your thumbs and you lift the towel, then place it down, because now you have a nice little gap. They're not gonna feel like you're trying to choke out. You're still removing product, keep that in mind. So I usually just do a nice swipe on the side, open up, back into the face. And I try to do this while this is nice and hot, and then you wanna press like on the eye area gently, because it just feels really good. And I think your eyes in a facial can kind of get neglected. Sometimes they might get product on them, we don't notice, like they just don't feel, you know, like a part of the facial as much. And when your client has the towel on, you do want to hit the pressure points. So, you know, you do the chin, we'll hook right here under the cheeks, a little pressure point there, and then of course the temples. Always feels really good. Brow ridge, pressure there. And then slowly taper off. And you can remove any remaining exfoliant or product. Like at this point, like the skin should be completely free of all product. There should be no leftover product anywhere. Sometimes I will do a quick sweep of the back of the neck if I feel like I might have a little more product there and I didn't get it with my sponges. And on my clients, we're going to take a quick look at your skin, see what's going on, and then we will go from there. Cool eye pads. You want to press these on fast and just hold them in place, because if you kind of are timid about it, they are so cold that it could be like, ugh, ugh, ugh. So you just want to pop them on and then press and hold for like 3 seconds. I usually cover up the décolleté so they're not so chilly. How is the bed feeling, Emily? Are you okay? Not too hot or cold? Okay. So we're going to take a minute to look at our skin. We use our little glasses with the magnification, turning on the light. I try to cover their eyes. The iPads are not very light blocking, so just for their comfort, when I can, I'll try to cover their eyes and then look. See what's going on. This is a good time to compliment your client, because most likely you're gonna say something that might make them feel like, oh man, I really do need to work on that, or yeah, I need that. So it's a good time to be like, oh my gosh, your eyebrows are so pretty, or you have like the best lips, or something that you genuinely can compliment them on. It's a good time, because this is probably like the time where they're like the most,
They tend to feel like they're in the hot seat.
panicked, yeah. So skin is looking good. I do see a few areas where we could do some extractions. I want to do like a mild enzyme treatment on you to help loosen up any dead skin cells so we can have a good exfoliation with our dermaplane. Good, okay. So I like to take the eye pads off, but you can choose to do whatever. Take the eye pads off and then apply the medium that I want to apply for our dermaplane. I usually do some kind of acid or enzyme treatment to loosen up the skin for dermaplaning. And I am a little hesitant to dermaplane you even still. You have a few breakouts going on that I know we're like trying to do a dermaplane facial today, but I actually just don't think that dermaplane is the right thing for you to do today. So we'll go over dermaplaning some other time because you're a little sensitized, you have some redness, and then you have some active breakouts that you really don't want to go over. Charlotte, your thoughts?
Do you mind if I get a look on the headset as well?
Yeah. Pads back. Nice and cold.
I agree. I mean, it's one of those things you could, but it's not really going to be what's best for your skin right now.
Yeah, I feel like we could.
Yeah, like you could, but it would probably aggravate everything already there. Not even probably, it would, and it's not going to ultimately help your skin heal. So, yeah, I'm on board with that.
Here's what I would do. We'll switch it up. We'll pretend, we'll make believe that we're doing a level 1 facial because now we are. Yeah. These are quicker. No dermaplane is really the only difference. So she's got her eye pads on.
And that'll happen sometimes, like people will schedule for one and they need the other. Don't be afraid to make that call.
And so we're gonna put her little eye wrap on. So this is gonna keep her eye pads on for me while I take a look at her skin. At this point, I'm gonna go ahead and do a little microderm abrasion in the areas where she's got some congestion, and then we'll do extractions. So, I will let you know that. We're going to do a little microderm. Oh, I just will be, I won't, yeah, I mean, I don't even have to touch it. We can skip that.
It's completely up to you.
Okay. Oh, I'm going to adjust the bed. If I have to touch the remote control or really like much of anything, I try to grab a little tissue and use the tissue to push the buttons on the bed so that it's just less chance of like any cross-contamination. So with her, this is the mini microderm. So this is what you would use for like noses, small areas. I like to do the whole face in this. That's what I'm gonna do. If you wanted to, you could get the bigger tip. Oh, I just right to that part. Okay, so we're doing some microderm on the nose to start because that's gonna be like the toughest area of skin. And so when you're microderming, you have to support the skin, just like you do when you're dermaplaning. So you place your middle finger and your thumb on the skin, and you make a little C. And so the rule of thumb is you work within your C. So you're not gonna just come microderming all willy-nilly out here unless you're supporting the skin. Supporting the skin, and then you can do it. when you are doing a microderm, you want to work in something that's called like a crosshatch pattern. So you're going to go vertically all the way around, and then you'll turn to the side and you'll go horizontally. So you're making like a crosshatch of every section. And you can do that just based on your client's skin. If they can handle that much, you can do that. Some patterns will vary just based on the client's facial features. I will microderm inside of the ear even, like going all around the ear. You want to check behind the ears. A lot of people can have breakouts there, and then inside the ear there can be a lot of buildup.
Try to warn them before you go inside the ear, because if you don't, your client might jump off the table.
Yeah, it's a little startling.
It feels a little weird and sounds a little funky.
Normally I just say exactly that. This might feel a little weird, but we're gonna do a little microderm just right inside of the ear to clear any congestion.
And once you say that, then they'll be like, oh my gosh, yeah, I want this and this.
So you can microderm over little things like little tiny scabs or dry skin, but you don't want to microderm over like an actual open pustule. There's no point of microderming over that. It's open skin. It's exfoliated to the max. There's no more to exfoliate there, but you can definitely go around the area. When you want to work on either side of your client's face, you're going to move them. I don't like clients to lift their neck when they're laying like this. I feel like it's easy for them to pull or strain. So I usually come to the shoulders, go around, and I hook my hands underneath the base of their skull, lift and turn. Sometimes they'll help you, that's fine. I prefer that they don't. I usually say like, you can just relax. And so I am going to do inside of your ear, not because you super need it, because I just want you to feel what it feels like.
I was told I have a pretty big black ear recently.
Yeah, and I'm going to extract that for sure, but you only have one. So normally I would do this if they had several. So we're just going to do a little dermaplaning a little microderm right inside the ears that feel a little weird.
It does.
I hope you don't laugh.
No, it's ticklish.
ticklish.
It is ticklish.
So tickly. Okay. Perfect. And then I'll hook it again and I will move her. And sometimes they're sleeping by now, so you really don't have a choice but to move them yourself. She's looking great. I exfoliated just in all the places that we needed to. Any place where she had like any scabbing, dryness, I exfoliated to where I was comfortable. If there's like scabs, sometimes you want to leave them there because they're still healing. So you just have to know the difference between one that's ready to come off that you can go over and one that needs to stay there so that the client can continue to heal in that spot. I'm going to check the chin real quick. Okay, perfect. I'm going to put our Microderm away. I might come back to it. I might need to use it again. But I'm using just a little tissue to like push the buttons so that I don't have to touch it. And we're going to do a few extractions. Do you think it'll be comfortable just to do that one side of your nose, or do you want to skip the nose altogether today?
I think if we just stay on the left, it'll be fine.
Okay. I always start my extractions with the nose. It gives me a really good judge of what the rest of the extractions are going to be like. You know, if she's hydrated, usually a little squeeze on the nose will tell you. If nothing is coming out and you can see that clearly there is something there that should come out, you can they're dehydrated, and it'll be a little bit of a struggle. So, you know, you have to go as hard as you can without compromising the skin or their comfort. You know, if they can't take it, then that's fine. Then you just move on. So you press until you can get the extraction, or you feel like it's going to compromise the skin if you go forward, and you just abandon your extractions. Not all of them, but you're not going to keep working on something that you know is not going to come out. They're just going to have to, they'll get a benefit from everything that you've done in the facial, and then when they come back the next time, they'll be more hydrated, and you'll be able to get more and better extractions. I just tell them like about 3 days before their next facial, go ahead and start hydrating. You know, have more water, less soda, put lemons and limes in your water to hydrate on a cellular level, things like that, and usually they'll remember. Okay, so we're going to do a few extractions. And I'm probably going a little more gentle than I normally would because I know she has a little nose injury on the other side. So, let's see, you might be a little dehydrated, but luckily you just have just a few, like, little bit of congestion on the nose, and we will address, we'll go ahead and do a few extractions on some of the other breakouts that are going on. So when we do extractions, I lay out like a clean tissue that I can work off of and throw away. So if she has like a blackhead, I can put it over here on my tissue and throw it away when I'm done, so it's not just like floating around in the air. It has a place to land. You can use gauze, I use tissue. Sterile lancet, you can open it, nice and sterile, and then this is going to be the best thing to do your extractions with. When we use this on her extractions, we're breaking the skin in the exact way that we want it to break, in the exact spot, so that it's going to heal a lot faster, and just not have that much wear and tear on the skin. It's not going to explode in like a jagged way. That's usually what causes scarring, and just faster healing time. Forehead ones are always sensitive. You won't be here much longer. So I can show you another time, like when you're like shadowing me. Oh, actually, we could probably come over here and look. But I'll show you on the next pimple. Okay. So this one in particular, we definitely got some stuff out of it. This one is more of like an oil pustule. So it's kind of one of the ones where just oil is going to come out and you have to milk it a little bit. So I'm not going to use like extreme pressure because I'm not expecting like a giant seed to pop out of here. It's just going to be like milking out the oil as much as we can without compromising the skin or her comfort. Okay. And you can see that like it's just oil coming out. This is all clear mostly. And also if you know something is going to be uncomfortable, if like, let's say I do like a big squeeze, I'll usually like tap on their skin somewhere else. It's just like a deflection and it helps with the pain. Okay, that's looking pretty good. I will probably revisit it like before we wrap things up with our extraction. So that's just a clogged pore that it's kind of like a blackhead, but we were able to kind of get our little sterile lancet in there and hook it and pull it out, kind of like a cork. I don't even know if you can see that on the end, but it is there. So most of the time with extractions in your sterile lancet, you're going to be coming in at an angle of the pimple because you don't want to come in at the very top. Usually that's the center of the most compromised skin of a pimple. It's the most stretched out. It's surrounded by the most infection usually. So you want to like, here's your pimple, here's the top middle of it. You're gonna come into the side, not into like the very healthy skin, but just the end of the compromised skin. Let's say this is all whitehead. You're gonna come in right at the baseline where the whitehead starts and just make a little tiny line with your sterile lancet because it's almost like a little tiny knife. It's flat and you can just kind of slide it right on the bottom and then slide out any of the pimple, infection, whatever it is. This one's a little bit tricky. Have you extracted this one?
There is a mole over there that got scratched the other day. That might have a scab on it.
That's exactly what it is. So this is just a little mole. Goodness, how did it get scratched like that?
I think my cat maybe, or maybe
Dang.
it's itched something too hard.
So we're gonna leave this alone. This is a little mole. So asking questions for sure when you're not sure.
There is something underneath it that's not the mole, but the one with the scab on it.
Yeah.
is the mole.
So she does have a little breakout right underneath. It is hard to see exactly where you want to use your lancet. So sometimes you can squeeze it and see the most white area will kind of come and you'll be able to see a little bit better. And I can see that it's going to be right here on this side. So I'm coming into the side and then sliding. And we're just making a little way to get out any leftover infection. do the one on her ear. I don't know if you can see this. Can you come a little closer? I don't know if you can see this like with the naked eye or not. But she's got a little blackhead right there in her ear. And you can see that it's bigger underneath than it is on the surface. So if I were to squeeze that or take an extractor tool to that as it is, it would not come out because the base, you know, we're only looking at the tip of the iceberg. And what's underneath is a lot fatter. So I am going to use my lancet just to kind of make one little opening on the side so it can, the pore can open up a little bit and extract the rest.
All around the stack.
Holy moly.
So sorry. I thought I canceled my alarm to pick up my daughter.
That is so funny.
Not bad.
It sounded possessed, girl. That was horrifying. So if you can come over here and try to see what I'm doing, I think there are like extra loops in the closet, but if you can see it with the naked eye, that's good too. So this is like, you have to hold it by the flat part, and then we're going right into the center, and then just creating a little space. Okay, so I feel like that probably wasn't good enough to do the trick, but we're gonna try anyway. Just to give a little pressure, nothing major. So this one's pretty deep, and I don't want to apply like that much more pressure. Like I want her to be comfortable. So if I can pull it out with tweezers and avoid doing pressure, I will. And I think that did it. Okay. Yay! I know, right? Hallelujah. And she had more in there after I removed that one piece.
I'll go to cleaning that hair structure twice, so I'm just getting nervous with it.
Oh wow. Gosh.
I think I'm losing hair again.
Okay, it's looking good. We were able to extract like maybe about half of the things. Oh, we forgot about this guy. Yeah, but it's time. It's gotta come. Same as up here, it's like an oil pustule where it's just like you just have to like milk the oil out of it. Thank you. And you can just set it right there for me. Okay, so I'm only really extracting the bigger one here. Good. We always do check the brows to see how they're looking, and we will do like a little cleanup of the brows, but not like major. I think they look pretty good. Like we'll definitely, you know, like get in the middle. Yeah, but if they need like a full wax or something, you know, that's a whole other thing. But she's good. If you want, you can dermaplane your brows instead of waxing them. Too much. Pulling. So I would love to show you dermaplaning it's just one of my favorite things to do, and especially around the eye area, around like this temple area and the eyelids. Doing the eyelids makes such a difference when they go to put on makeup or anything like that, like eyeshadow, powder eyeshadows. It just settles so much better, and it's a good opportunity to clean up the brows while you're doing that too. But I just tweeze any of the what is it called? Terminal hairs. It's been a minute.
Terminal hairs.
And then leave the vellus, and then if you wanted to, you could wax it later or dermaplane it, which I prefer to dermaplane. And she's looking pretty good. I do think she might benefit from just one more quick little pass of the Microderm, so I'm going to do that real quick. Bed still feeling pretty comfy? Okay. If you've done extractions and you're going to either dermaplane or, well, you wouldn't be dermaplaning over extractions because we dermaplane first. But if you do have to microderm, make sure you're going in the direction of where you made your little incision. Like, let's say you made an incision here on the right side, which most of them will be on the right side if you're right-handed. So you don't want to go the opposite direction and open up the pimple again. You either want to go vertical on it or from left to right. I go ahead when I know I'm done, take this, throw it in my water bucket, take the filter, put it on my extraction, either 4x4 or a napkin, and then I fold it all up and throw it in the trash. And so we're done with extractions. I can sit her up a little bit. I tried just to keep the client comfortable, to not have them fully back as much as possible. And so we've done like a rough exfoliation with our turmeric, with our Microderm extractions, and we've tweezed. Now we're going to do an enzyme exfoliant. The product that we use is called Theraderm. It is designed to only stick to the dead skin cells. You just need one pump, and you're gonna massage it into the skin like 3 to 5 minutes. It goes on nice and smooth, but in a minute or two you'll feel it start to get kind of gritty. You all right? Tingly?
No, just this one.
Oh, sorry. So you'll feel it start to get a little gritty, and that is the dead skin cells coming up. They're lifting up and rolling away. I always like to tell my client that because I think it's fascinating, and they know what you're doing and they know what they're paying for. So this will give her a really nice polish. And you'll want to keep massaging gently until you don't feel any more dead skin cells starting to come up. It'll continue to be smooth for a few passes, and then you'll know that you've lifted all the dead skin that you're going to lift from that area. The nose is a big one for sure, where we get a lot of dead skin cells, especially on the sides of the nose and around the nostrils. Those areas tend to get a little bit neglected. And right under the brow ridge also, this is an area that doesn't get probably enough exfoliation. hit the eyes really good with this. You can do this little motion. You can do the little effleurage motion on the eyes. It's just going to be so good to get around the eyes for clients who are experiencing fine lines and wrinkles.
Or milia. That's a big one. You'll get a lot of clients, especially referred from the derm side, who have milia around the eye area, and using this stuff, especially after we've been able to extract those, is really nice to help keep those away.
So this is feeling really nice. You can do two things. You can go ahead and remove this with a towel. What I'm gonna do is I'm actually gonna give her a little more of an exfoliant. I'm gonna put, you're gonna be fine. I'm gonna give her a little bit of this pumpkin and yam enzyme. We're only gonna let it sit on for like 2 or 3 minutes. Nobody clutched their pearls. It's gonna be okay. I promise. Because we're not letting it sit on, but this is just great for brightening, exfoliating. I feel one of the biggest causes of acne is when your skin is exfoliating, but it's getting trapped in the oil on your skin. It's not sloughing off properly. So the more we can do to exfoliate is going to help any of her acne issues going forward. So I'm leaving on this exfoliant and I'm just going to work right over the top of it, leave it on for a couple minutes. You can put this on with your gloves and your hands and massage it in. I'm just going to use a little brush for today. This is going to feel a little chilly. And I'm going to do it in the areas where she needs it the most. Obviously, we're not going to do her cheeks. Her cheeks are a little rosy. We're going to skip that, but we'll do like the T-zone for sure. It's going to feel a little chilly. Doing okay? That's a big area where the dead skin cells can get stuck because you have a lot of oil here because you have hair follicles. So exfoliating extra in these areas is good. You too, Uncle. Are you feeling okay? Is it tingly? Would you like a little fan or anything like that? You sure?
It just feels like little needles. It's okay.
You know. That's fine, right?
Beauty's pain.
No. Anywhere where it's feeling like more tingly than others.
Really just around my hairline.
Okay.
That's where I have my biggest sebaceous glands. That's really why.
Yeah. So just gonna leave this on for a couple of minutes. I'm gonna go ahead and put my thingy in my bowl. So while this is sitting, I'll go ahead and pick out her mask. You doing okay? Mm-hmm. You sure you don't need a fan? Mm-hmm. Okay, cool. And I want to do a hydrogelly because I just want you to see how we prepare it. So I'm gonna get that together while you're chilling. Let's see.
How you feeling? Deep breaths, deep breaths, deep breaths.
Yeah, it's not that bad.
Okay, good.
It almost feels like pine straw. You know, the sharpness of pine straw.
Yep, yeah, for sure.
Okay. So you can mix these. You don't have to, but I find myself mixing them all the time. We're gonna do the beta carotene floral, which is amazing with helping with redness, calming the skin, and we're gonna mix it with a little green tea tree. So this does have green tea and tea tree, and so this is really great for helping with inflammation, acne, and this one's gonna calm and soothe. So the ratio for this is 1.5 scoops per every 1 full scoop of water. So I'm gonna do like 3/4 of each one, 3/4 of a scoop for each one. So it equals a 1.5 cups. I mean, you know, a 1.5 scoops.
If you look, there are going to be 4 lines on there. I go 3 line for each of the 2, and then 4 line for my water. Makes it work every time.
Tap that out, and you're gonna come over to the faucet. I usually rinse all of the mask off of it so it doesn't stick to here, because it will. Now you don't want to add your water until you are absolutely ready. So I have a few more steps on her before we're ready. So I'm just gonna bring the water with me and mix it in a minute. How you doing, girl? Okay, good. So we're gonna go ahead and remove these 2 enzymes that we have on her. When we go in with our towel, we don't want it to be too hot because she's already had a lot of heat on her skin. So we're gonna cool it down significantly and then place it on the décolleté and shoulders to cool down even more, and just kind of let it relax. And still focusing on like removing any product. There might be leftover product, you don't know. Just give it a good wipe. Cool it down. It's not going to be cold by any means, but it's not going to be hot. Press slightly on the eyes, 3rd eye, give the chin a little pressure point massage, temples, and then we're going to remove very gently. You don't want to rub. Be sensitive. How you feeling? Yeah, okay. And we'll get this off ASAP. Where? You can scratch if you want to. Yeah, go right ahead.
I'm just gonna point to it because I don't want to. A little up. Right there. Thank you. I'm so funny about touching my queen skin. Like I don't want to.
Thank you for that.
That's why I asked earlier.
And you really want to make sure you're removing all of it, especially if you did, you know, like a time sensitive one like the pumpkin and yam. You want to get that off. You don't want it to go too far. And because she's feeling a little warm and a little sensitive from everything that we've just done, extractions, Microderm, a couple of enzymes, we're going to have her take a big deep breath in and then just let it out slowly whenever you're ready. And we're gonna do just a soothing toner just to kind of cool her down. This is the Stone Crop Hydrating Mist. It's really gentle, helps with redness, dryness, just soothing. So nice. And so that's a little treat for her because she had to endure all of the things. And I am going to take a minute just to readjust her hair. And whenever we're doing this, we're doing it extra. We're doing the most. We're rubbing the back of her neck. You know, a lot of people have sensitivities in their neck, so laying like this can be stiff for them. So taking the time to really get them to turn their head, give them a little pressure, can make a difference, and then being comfortable for the next 2 minutes while you finish everything. Okay, we're going to do a little high frequency. Are you still feeling comfy? Do you need me to adjust anything for you? A little warm? Okay. I'm gonna go ahead and turn it off.
Okay.
And then you can like pull your arms out of the covers if that's more comfortable, if you just want to cool down a little. Yeah. Is that better? Does that help at all? Okay. Were you groaning a little bit when I mentioned high frequency? Okay. So,
because I'm a baby with it, but when I do it myself, I get to control the level.
We'll go gentle.
So.
Okay. How familiar are you with high frequency, Sabrina?
We only did it like a couple times at school.
Okay. So most of the time you're going to be using your little mushroom nozzle. This is great for all over the face. This is going to help reduce the swelling in the pimples, reduce any infection in the pimples, and heal them faster. So you want to take a little gauze and wrap it around your mushroom head, and then tie it off with a little baby rubber band. So this little gauze will create a nice little layer of ozone gas that's going to go over her skin, which is going to make all of those awesome things happen. Put it in our little device here, and we're going to turn it on low. We got it on 1, girl. It ain't even working, it's so low. Hold on.
That one takes a minute to
Do its thing,
but
okay.
yeah.
So I don't need to wiggle it or anything?
No, a lot of times what I do is you can either wiggle it or I will turn it up and then turn it back down.
That's what I do.
Yeah, there you go. It's awake now.
So, if you've touched this, Sabrina, and you put your hands on it, whatever, so if you want it to be completely sterile and ready to put on her face, just touch it. It's sterile now. Like, it completely kills any germs or anything on it. We're going to turn it way back down because that is high.
Yeah.
Okay, we have got it on. We're on 1.5. Okay. I am a baby. So when you place it on their skin, you have to keep your finger on it until you place it on their skin, then you can let it go. If you don't, it will shock them. Not in like a horrible way, but it's just a little uncomfortable. If they've never had high frequency before, I say, okay, I'm just going to do a little bit on your shoulder so you see what it feels like. Give them a little tester, and then put your finger on it again and lift away. How was that? Is that okay? Okay, good. Then we'll do it here. She's got a little breakout right here. We'll address that.
Freaking cat laying on it.
Okay, now as we go to the face area, is it still feeling okay? Okay. And really the only thing with this is you don't want to stop in one spot. You just want to like just gently move around. You're going to see the most benefit on the like larger pustules that are still kind of swollen. You'll be able to see them kind of start to shrink down. How you doing? Okay. Okay, it's not up too high.
No, it's really not bad with the gauze and full contact.
The gauze helps a lot. Really the only time you will like stay over one area is if you're using what, I mean, I don't know what you call it, Heather, but I learned it as the spark tip.
Okay.
Which is like a little teeny tiny ball at the end. And even then, you'll just like give them a few zaps, go to somewhere else, we'll zap somewhere else, zap somewhere else, and then you can come back to it if you need to. And that's really good for basically if you've just got, I mean, I go over with the mushroom tip first. That normally does the trick. But if you've got some places that are just being angry pants, that's a good one. That's a really good one.
And I'll do that one real quick next, so you can kind of see that one too. Which I'm sure you've seen it, but see it again. Is it okay? Okay. see it's looking great. Release, very important. If you're changing tips, turn it off first. If you just take it out while it's on, you will shock yourself and it is uncomfortable.
Yeah.
All right, here's our little, now that you asked me, I can't remember what we called it. I think we called it like some kind of zapper, but anyway, so then now you're gonna do a technique, which is, I can't remember the name of the technique that we called it either, but maybe it'll come to me as I'm doing it. So you can test this on yourself if you want to. That feels fine to me. Test it on you a little bit. It's gonna zap. This is the one that's the most uncomfortable.
Because it's all concentrated on that one spot.
And you don't put your finger on it and then put it on them. You actually want to cause a spark. You'll just, and then gonna,
if you want to, you can like go in and see, but there will actually be
on this side.
Yeah, there will actually be a visible spark.
So this is the kind of pimple that you want to treat with this little tip because it's still raised and it's one of those oily ones that's really hard to extract, and this will help with the swelling tremendously. So you can just watch as we do like a little zap. So you kind of do like, 1 or 2 seconds, 3 or 4 times. The only thing is you just don't want to create a lot of heat. So you want to like do it as much as you can safely without creating a lot of heat. So we're going to do the cheek one. I'm so sorry. My name is Abby. Okay.
It will after a while, yeah.
Okay. Really over here is good. I might just give this one a quick little zap just so it can continue that healing. Right here, this is going to be uncomfortable. This one would not extract, so I'll need to zap it. Sorry, thank you. And then other than that, it looks good. I am going to zap your little injury here. Just make it heal a little faster. I really like to do this until I see an actual reduction in swelling. As long as I'm not creating too much heat, as long as I can see that there's not a lot of redness in the tissue, I will go. As long as they can tolerate it. Are you okay?
Yeah, it's
sure? Okay.
and you will start to see it after,
Yeah, it's definitely reducing. Yeah. It's looking a lot better.
Especially the stubborn ones like that. They'll be like, no, 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 and then they'll take the hit.
And I'm a big believer is if I try to extract something, if I start to manipulate it and mess with it, you have to see it through to the end.
Yeah.
Even if it won't extract all the way, you have to find a way to minimize the chances of that it's going to flare up again and just become an even bigger problem for them. If you touch it, so sometimes you just have to make the decision, I'm not going to touch that one because it's like a can of worms. So we're going to take our mask. I've got both of them in here. Add our water. And you just mix it up. It usually will take about 60 seconds of mixing. Sometimes you have to add a little more water. That's good. It's easier to add more water than it is to add more mask. But I'm good. I don't need any more water. In fact, I might need more mask. Is it finally cooling down a little bit for you? Okay. I think we can make this work. I don't think it's too drippy. Is it comfortable if I go over your eyes and lips with this to give you a really nice treatment in those areas? I do love these masks. I feel like the eyes and lips can get neglected a lot when we do our mask treatment, and this gives them just the same treatment as the rest of the face. So you can do this a few different ways of applying this. I do it different ways all the time. I think today, because her cheeks are so pink and I feel like it will feel the coolest on her cheeks, I'm just gonna apply it to her cheeks nice and cold. Right over the eyes. And the eyes, you can really fill up the entire like orbital cavity with the hydro jelly mask. You want to make sure you're doing a thin layer of mask so that you're not, you know, globbing it all on into this area and just wasting it. You'll run out of like mask for the chin. So just a nice thin area over the eyes.
On the other hand, if you accidentally mix up too much, that's a great spot to put it.
True. That too.
Normally if I mix up too much, I try to extend it down onto the neck or something like that. But
the company who makes these is called Estimax. They actually do have spatulas specifically designed to work with these bowls. You can use the spatula. It probably works best, but I like to use this because I don't have to clean it. I can just throw it away. A little tongue depressor. That is your call. And we're gonna go right over the lips. And if you should need to, you should be able to open your mouth just fine. If the mask starts to get a little firm and you feel like you want to open your mouth, you can just raise your hand and I can take it off of your lips really easily. I say that to every client just so that they know they have an option if they do want it off of their lips. And I've never had anybody raise their hand, but if they did, I would just take it and either scoop it off of their lips, or if it's nice and hard, I would just pop a hole in it so that they could open their mouth. Because it will get firm in 10 minutes.
what gets really funny is that when they start snoring under this mask.
Little trippies, I'm so sorry. I knew it was too thin. So when you feel like the mask is too thin, their body heat is going to make it even more thinner. So I don't like a runny mask, but that's just what we got today. And this mask is a lot like using hard wax. You want to kind of build up like a nice border on the bottom so that you can have something to grip to pull it off. If it's like really thin and flimsy, it'll be harder to get off.
That must be why I instinctively apply it like hard wax.
Right. Okay. We're gonna let this hang out for about 10 minutes. And then I am gonna clean up my little area where I've got some drippies, because it will just keep dripping. And I'm about to do our massage next. Okay, I think this would be good. So aromatherapy is the next step for all the facials. You do the mask, you do aromatherapy. I'm gonna do lemon. So I just stopped so I could count how many drops I do. I just did 10, 11 drops, and mix it in your hands, and then bring it around the client's face, like super gently. You don't want to have your hands blocking their exhale. If they breathe out onto your hands, they can feel that pushback of like something being super close to their face, and it can be uncomfortable. So watch their breath, and you don't want to be like smothering them when they're trying to exhale. Charlotte does this lovely little rocking motion, a la Aveda.
Yes.
And you really want to hold it here for at least 3 good breaths for your client. And then depending on what the oil is, I usually always take the extra oil off my hands, touch their shoulders, bring it down and around their neck, and then the rest on the towel, so it will continue to be fragrant. And then I get 1 pump of massage cream. That's my favorite thing to use for massage. And we do 10 minutes of neck, shoulder, scalp massage while this mask is setting. So doing okay? Starting to get chilly. You want to tuck your arms under? Are you all right? Okay, good. So we're doing a lot of those neck and shoulder massages that we did with our first cleanse. But we're really kind of going down deeper, like onto the pec muscles a little bit. Working that like lymphatic area. And then you are gonna go down the arms, like to the elbow. So taking your thumbs and like massaging the biceps, and then this little area close to the elbows feels really nice. Coming back up. And I usually just keep an eye on the clock. I just time myself. There's always a clock in view, just so I know like when I've gone 10 minutes. But this is like the moment they've all been waiting for. Like, just relax and get massage. Depending on the mask you use, you can also give them like some LED treatment, infrared treatment, while you're doing massage. That's like a little extra thing. A lot of clients don't know about light, red light therapy, blue light therapy, so it's a good time to like show them something new. You know, it's another thing that can add value. That's why we tell them every step we're doing, all the ingredients, why we're doing it. And we're gonna lift. And so I actually cradle, at this point I'm cradling her head in my hands. So my right hand is like kind of cupping around her ear, but I'm holding on to the towel. And now I can move her if I need to with my right hand while I'm massaging the back of her neck with my left hand. And everybody has tension here, so nobody's arguing with you at all about massaging the back of their neck. Emily, you doing okay? I really like to get the base of the skull right here. And although we're focusing on the left side right now, we're still massaging the right side with our fingers so you can't see. But we're giving it like a little squeeze in like a circular motion.
You know, it's really funny. I was actually on Instagram today. I saw a facial tension specialist talk about those points and how it releases tension in the eye area.
Totally. It's amazing like how everything is connected. I really do like to do a lot of work like back here, because I feel like sometimes this is where a lot of the tension starts, and then you're wearing it on your face like before you know it. time I want to move her, I'm lifting and supporting her head. And we're literally just doing the same thing on the other side. Doing a little, it's almost like a little pinching motion with your thumb and pointer finger at the base of the skull. And you can flip your hand around and use your fingers. And honestly, you should be able to feel how good this feels. At this point, you really should be like pretty connected to your client. You touch them enough. They're relaxed, and so you're kind of like vibrationally in alignment, and you can really feel like where they're holding tension, where they need the massage more, and what's going to help them the best. You will do different massage movements on like either side because everybody's not perfectly symmetrical because, you know, we're either right or left hand dominant. So you're going to have different muscle patterns to work on. And Charlotte, I know we're going past 3.
No, it's
good?
fine.
Okay.
I thought that I got a text message from Pop Top, but we're good.
What's Pop Top?
My father-in-law, that's his grandpa name.
Cute. We're about like at the 6 or 7 minute mark for our massage, and I've usually done both sides by then, and now we're doing both hands to like the base of the skull, and we're working around behind the ears. You want to use like lighter pressure around these areas, but just like a little gentle circular motion can really feel nice. There's a lot of like little muscles back there. And then this is like the second and really only time besides the end of the facial that you get a chance to do anything with their hair. If you feel like you have like too much product on your hands, you can do this in a minute, but I don't, so I'm gonna do it now. Just a little scalp massage. Okay, okay. Focusing a lot like on that temple area. Nobody's ever going to be mad at you for playing with their hair. They're going to be like, I'll pay extra if you can just do that for a few more minutes. And especially with her hair, it's like so thick that it gets heavy. And so it feels even that much better to have somebody move it. And then I always go, like, when I'm finishing the scalp massage, I do pull it all the way out to the very tip. Like, you can still feel the sensation all the way down.
If you have a client with hair extensions, instead of doing the shampoo movements, try to, like, almost do like this along where the extensions are. It feels so nice.
Yeah,
nice.
Even when I had extensions, I was like, please give me a scalp massage.
But sometimes the shampoo movements can almost like pull on the extensions a little bit and feel uncomfortable, so if you do it more like this, they're very pleased.
So I always take off the hair wrap at that point where you saw me pull it off, and then I do my scalp massage, but I'm going to use this again, so I put it to the side. And we're going to take our warm towel and we're going to remove any massage medium, starting with our own hands. I'm going to put finishing products on her later, and I don't want to have massage medium or anything else on my hands. So take your hot towel, give your hands a little wipe. This is going to be nice and warm. Gently. Place it on your plant. And then swipe up and bring it all the way around to the back of the neck, and you're even covering their ear. And then you're swiping up again after pausing. Same thing, other arm. Don't want anybody going home feeling like greasy. So this is really good for making sure that you've removed any extra massage mediums, because they don't really absorb into the skin. Then back of the neck, nobody wants the back of their neck to be greasy feeling. So make a little sock puppet, go around the back of the shoulder and the back of the neck, flipping your hand around, and you have gotten all that off. And flip it around, you've got it all off. And then if I still have some heat in my towel, I will hit the décolleté once more. And then just wipe anything off. If there's any product on the neckline, I go ahead and wipe that with my warm towel, because the next towel will be cool and you don't want it touching the décolleté at all. So I go ahead and cover her up. Put back on our little towel to cover her hair. It's right over the top. Just kind of like run my fingers over it for some reason. I don't know. I like it this way. And you can start from the bottom or the top to remove this, whatever works for you. Sometimes I like to show it to them if they open their eyes, and I'll be like, isn't it pretty? So if you didn't apply it like absolutely perfectly like you would your hard wax, still be like a little few pieces of mask left over, and we're going to use a nice cool towel. And you do not want to touch their neck with this, just their chin, nice and cold, and then bring it up on their cheeks. And let's hang out for a minute. Pressure points nice and gently. A lot of times, because my hands are nice and clean right now, I don't have any product on them, I will go ahead, let her sit with this towel on and get all of my finishing products together. So I don't have to touch any product bottles with oily or producty hands. So whatever I know that I'm going to use on her, I go ahead and set it out. We are just like super gently removing any leftover mask. You don't really want to put hardly any pressure on the skin. Most of the time we do a dermaplane, and that will make you pretty sensitive. I know I've got a little piece of mask down here. I'm gonna be a little more aggressive because we didn't do that much work right there. Sorry. perfect every single time. We're gonna finish with a toner. I'll have you take another big deep breath in just like that. Just let it out slowly whenever you're ready. You can do 3 sprays, you can do 1 spray. I like go nuts and like make it rain. So that's up to you. I really like it. It's just so nice. And I tell them what it is. This is our Stone Crop Hydrating Toner. It's going to balance your pH. Really is amazing with healing, brightening the skin. And because of the issues that she's having with her skin, the kombucha microbiome balancing essence is going to be a great thing to put on her skin. This is going to balance your microbiome. It has pre, pro, postbiotics. It's great for preventing breakouts, nourishing the skin, giving you a really pretty glow. I always go over the eyes with anything that is a soothing product. I do it at home. I have very sensitive eyes. I do it for every client. I don't like to neglect the eyes.
And Eminence products are made so that you can do that.
And then when we're doing these finishing products, we are like barely touching the skin. It's nothing like when we started out where we're doing these like aggressive massage movements. We're like ice skating with the fingers, just super like barely touching. Let's see. So we're gonna use, girl, this gel moisturizer is everything.
Is it what I think it is?
Yes, the Mucucciella niacinamide.
Yay!
We're gonna put that on. I'm obsessed. I love how it absorbs. It's gonna help with breakouts, anti-aging, hydrating, and it's just the nicest lightweight moisture that absorbs so well.
I also love that it helps with redness because niacinamide targets rosacea.
Nice.
And it's a brightener, so it'll help make sure
It has all the favorites in it.
it's just love it.
I'm
And
living
smells
for
so
it
nice.
for sure. We're already sold out, by the way. We gotta
Oh my
order
gosh,
more.
really?
Mhm. Well, they did short me like 1 bottle of it, so but we don't have any more. I've got to get them to send you them. Okay. So for her, this gel moisturizer, I still want to add something that's going to be a little more like occlusive, that's going to be like a thicker moisturizer than just a gel, because I want to lock in all of these and continue to nourish and heal her skin. The kombucha microbiome leave-on mask is like an amazing finishing product for basically everybody, and for her, we're going to use it to help minimize the breakouts and the redness. And you really don't need that much. And this is a thick product, so you'll kind of have to dab. And then to get it to rub in, because we're doing so much light pressure, a little depulpment is probably one of the better things to do. It feels better than rubbing on freshly exfoliated skin. Doing a little tap.
That one is a multi-use medium. It's massage, mask, and moisturizer, like all in one. So you can use it for any of those steps, for whoever you think needs it.
And when I do depulpment, I do love to go underneath the chin, because everybody wants their jaw to be snatched. So just encouraging the snatch. And it looks so good. I'm really, really happy. I am going to do a little bit. I get nervous. Y'all get nervous when your parents call you think somebody died?
Yes.
Okay, this is the new sunscreen, Mucucciella niacinamide. It goes on so nice and smooth, so we can kind of like ice skate it on the skin, nice and super gentle. You never want to put just sunscreen on like, you know, just dry, non-moisturized skin. So I don't want to disturb any of the other layers of moisture. I just want to lightly set this on top. course, with the décolleté, we can do our normal application method and like rub a little bit. Start to tell her aftercare at this point while still kind of doing our little relaxing massage motions. We did a lot of extractions today. You might have a little bit of swelling and redness for about 24 hours. Just be a little more gentle with your skin today. Avoid like really hot water. Working out, going to the gym, getting hot and sweaty can be irritating to the skin. Neck cradle, just one little massage on the scalp, pull it back, and then finishing with one final pressure point on the brow to the temples, and then slowly taper off. Lift them up. We're all finished. Thank you so much for letting me work on you today. Your skin is looking wonderful. And then I just tiptoe and take your time getting dressed. Take some big deep breaths before you go to get up. I'm going to grab you a water and meet you out front whenever you're ready. And that is it.
And that is it. Alrighty. Wave bye-bye to the camera, Heather.